doing positioning for the mandible, and we're doing the essential projection for the mandibular rami. And I'm going to put the forehead and nose up against the board. Check and make sure that there is no rotation. Okay, and then our central ray is going to enter the posterior aspect of the skull, but it's going to exit out at the acanthion. So you want to double check and see that the central ray is at the acanthion, and I can come just a little bit lower, and then I want to collimate in. We do not need the entire skull for this, and this is the left side of the head, so that would mean that's the left mandible. So that is the PA mandible. The PA axial mandible, same position is maintained, except you want your central ray angle at 20 to 25 degrees. So you want to get your 20 to 25 degrees, and you want to double check, make sure that it is exiting at the same level as the acanthion. And then just adjust your bucky. Okay, and I can go just a little bit lower. There you go. Okay, and then put your left marker up here, because that is the left side of the mandible that we're going for. Okay, then on our next projection, we're going to do the axiolateral oblique. And I'm going to ask David to turn his head to the right. You want to do both sides, the right and the left side. Get the head in a lateral position as if you are doing a skull x-ray. Now this does use the same angle as our previous angle. I'm using a 25-degree angle. And have the head lateral. We are imaging for the rami. So double check your interpupillary line, double check your mid-sagittal line, that it is horizontal, and you're going to have the patient relax their shoulders down, because it is so easy to get an image of the shadow of the shoulder in the mandible. So you can see, looking at the shadow, how a shoulder shadow would affect your mandible picture. So make sure that it is relaxed down, and then you can have them extend the chin up in the air just to make sure that you do clear that area. Okay, I'm going to put a right marker on here, and I have my central ray entering in at the area of the gonion. So that is our right axiolateral oblique. You would do just the same thing when you're doing your left. Okay.